This video is about the holistic and family-centered care of postpartum depression. So what is postpartum depression? Postpartum depression is described as a period of depression that lasts more than 2 weeks and begins after childbirth. Postpartum depression on average occurs in 6.5 to 12.9% of births. What are the signs and symptoms? The symptoms vary widely. They can be reported as an increase in appetite or a loss of appetite, insomnia, hypersomnia, agitation, fatigue, feelings of worthlessness, diminished ability to think or concentrate, and in extreme cases, thoughts of suicide. Many postpartum depression sufferers verbalize feelings of anxiety, worry, loss of pleasure in things they once enjoyed, and feelings of incompetency at being a good parent. Changes in mood or emotional state need to be taken seriously and reported to healthcare providers should they start to interfere with daily living. So how is postpartum depression diagnosed? So it can be diagnosed by assessing and identifying risk factors such as social supports, a history of postpartum depression, and the use of assessment tools. Or we can look for nonverbal cues like the mother looks unkept, has a flat affect, does not hold the infant, has no ability to follow simple commands or focus, or the mother's appearance looks as though she has been crying or has been sleeping. So how can it be treated and how can nurses help? Education and early identification of symptoms are key. Postpartum depression affects the whole family, so it's important to educate the family on the signs and inform them of when they should call the healthcare provider for help. We as nurses need to perform thorough assessments of our patients. We must look for indicators that our patients might be experiencing postpartum depression. We need to speak to the families and just ask them how they're doing. 24 to 50% of men whose partners have postpartum depression also experience depression in the first year after birth. Symptoms of paternal depression typically appear with the onset of their partner's postpartum depression, and the number and severity of symptoms increase during the first postpartum year. Another barrier to getting help is that many families sense a stigma about postpartum depression and are embarrassed by the experience of depression following the birth of a child, which should, on most accounts, be a happy time in their life. This can be a barrier to both mothers and fathers seeking help. We as nurses need to have a conversation about postpartum depression with our patients to get rid of this stigma. Postpartum depression, like other forms of depression, can be best treated by the use of antidepressant medication, in addition to social support and psychotherapy. Selective serotonin reuptake inhibitors are commonly prescribed. They are generally well tolerated, but breastfeeding mothers need to be aware that antidepressants can be detected in breast milk. Fear of being simply given a prescription in combination with the fear of taking meds while breastfeeding may turn some away from seeking the help they need for their postpartum depression. We as nurses can provide education on the different available treatments for postpartum depression. There are a few other ways to treat postpartum depression. One way is to get more sleep. So mothers suffering from postpartum depression could greatly benefit from a more controlled routine surrounding bedtime and other relaxation techniques to induce sleep faster. Parents are also advised to sleep whenever the infant sleeps, even during the day, until a more regular sleep pattern for the child is established. So other forms of holistic treatments for postpartum depression include massage, exercise, omega-3 fatty acids, acupuncture, and use of light therapy.